it was 90% of deaf people are born to hearing parents. So that means of those hearing parents, most of them do not learn ASL fluently. So all of that family knowledge you have about your grandmother having cancer or your uncle having diabetes is not accessible to deaf people unless it has been explicitly told, which often doesn't happen. Your family history is incredibly important to figuring out a diagnosis in a medical setting. Without that, it's made the job a lot more difficult for the doctor. So the possible risks associated with being an amateur or underprepared medical interpreter is misdiagnosis. So just as easily as you can misinform the patient, you can also misinform the doctor. The doctor is working off of your interpretation to figure out what the problems are. So you could say the wrong body part or describe the wrong type of pain, which would give the doctor different diagnosis. Sometimes a stabbing pain versus a throbbing pain means different results. You can also give incorrect medical instructions or information, like instead of saying take this pill 2 times a day, you say take it 2 times a week or 2 times every hour, which is obviously going to very quickly create some problems. You can, through a bad interpretation, you can give the wrong information to the doctor, which causes expensive tests to be run or conducted that were unnecessary, or expensive treatments that do nothing for the underlying cause. All of this falls back on you as a medical interpreter for failing to recognize the situation. Another possibility is simply inconveniencing the deaf person. They could have to reschedule, get another interpreter. They might have to switch to note passing, which might be better than an underprepared interpreter. Or they could have delayed treatment, which could worsen their symptoms. There are also extreme examples associated with a misdiagnosis or a bad interpreter. There was a case in 2013 where a Spanish woman found out that she was 3 months pregnant.
What was the year?
2013. There was a case in 2013 where a Spanish woman found out that she was pregnant, 3 months pregnant, and there was no interpreter present at this doctor's meeting, and the doctor believed that she wanted to not have the baby, but she wanted to keep the baby. So he prescribed medicine to induce an abortion. So there are very real circumstances that can happen. So the Cady Center is working to establish, standardize, and popularize certification for medical interpreters. As I said before, you are the only person in a medical situation who is not medically prepared in any way, shape, or form. You have no medical training. If you don't know anatomy or where certain organs are located, that's going to cause a lot of miscommunication. So they have identified, and they created a bibliography and have identified 12 core ideas and competencies that medical interpreters specifically need to work on. Some of these do relate directly to interpreters as a whole, but they are ones that the medical interpreters specifically need to focus on to be able to clear up the job a little bit more for them. So these are the 12 core competencies. I'm going to give a simple breakdown for each one and why it's important and identified. So healthcare systems just means your general knowledge of how the healthcare system works. Private insurance versus public, emergency visits versus established scheduled doctor's appointments, one hospital versus another, general procedures such as what an MRI is or what a CAT scan is and does. These are things that aren't exactly covered in most of your interpreter training programs. If you don't know someone who works in a hospital or you've never looked into it, you might not know what an MRI does and how it works. That's going to cause a real problem when you're trying to interpret that. Multiculturalism and diversity. So not only your own multiculturalism, but also your medical professionals, their own knowledge of deaf culture, and your deaf clients. So due to the importance of a lot of medical settings, you have to really understand and play with that as opposed to a more typical interpreting situation because of the severity of the situation. So self-care is really important as well for a medical interpreter. It's important for all interpreters, of course, but medical interpreters often take on the role of what is happening. So if you're working in, say, a mental health setting and somebody has committed a murder or drowned their nephew, you have to physically act that out and you take on secondary stress and trauma because of it. Having access to self-care such as a therapist or keeping a journal or exercising are going to be very important things to do to keep your mind clear from everything that you're going to experience secondhand. So boundaries in this particular situation specifically applies to knowing your role as an interpreter and what lines not to cross, because the medical professionals might not know that and they might assume too much of you. So you need to figure out exactly where your stance is so that you do not intrude on anything about the situation. You're only there to make communication happen. You have to keep that line clear. Preparation is really important for medical interpreters because of the knowledge associated. If you don't have, once again, if you don't have a backup knowledge of what this specific doctor is or what the specific test does, you're not going to be able to interpret it. It's going to slow down interpreting a lot, cause miscommunication. It's going to be a problem. Ethical and professional decision making is something all interpreters face, of course, but in a medical situation, just like in legal or any other high stakes situation, someone's life could be on the line for this. So you have to clearly understand your boundaries and make sure you're doing ethical decisions. Language and interpreting, that one seems obvious, but you don't often talk about what's going on inside your liver or how your small intestines work, which is something that could easily pop up in a GI doctor's appointment. And if you don't know the situation behind that and how to do the classifiers, you can't convey the information. Technology. Technology is always changing, especially for cochlear implants. One of my friends has a cochlear implant that he has a little Bluetooth device for that he can target specific speakers in which direction for who he wants to listen to if he puts it in the middle of the table. So keeping up to date on these types of things is going to really assist you a lot. Research just comes down to doing your backup homework. Legislation is staying on top of any new laws specific to medical situations, such as the standardized universal healthcare. Something like that comes out, you're gonna need to know exactly how that works. Leadership is taking leadership and responsibility amongst other interpreters to ensure that these standards are met. And communication advocacy is exactly what it is for normal interpreters, but we need to make sure that the medical professionals are aware of it as well. And that's it. So with interpreting in a medical setting, there is a lot of risks associated, a lot of things that can go wrong, and misdiagnosis and miscommunications are a real problem. So standardizing and pushing for an actual certification with NRID behind the NIC is what the KD Center is trying to do, and it's something that we should all, if it doesn't get established, it's something we should all know about and try to take some form of medical classes, backgrounds, something like that, so we have the exposure necessary to actually interpret that situation. Questions?
Do you have different kinds of programs the KD Center offers? Meaning, is it a yearly program? Is it a month-long program? What do they do for their training? What does it look like?
Okay, so the KD Center and another association whose acronym I cannot remember, partnered up back in 2015 or 16, and their training was a 6-month training program with specifics for medical situations. You got a little bit of actual hands-on interpreting, as well as medical background knowledge and specific vocab for that situation. They also created a bibliography with a lot of resource links. Each one of these 12 core competencies has at least 15 research articles for it that you can research and analyze. They did, however, the other organization they were working with did, however, lose its federal funding. So that has not been updated since. But that's what the program was.
I heard about that, but there wasn't enough for that to establish it again.
Yeah, unfortunately, it has not been established again.
The Katie Center in Minneapolis, as part of St. Catherine's in Minneapolis.
Yes.
Alright, cool. Really, that's the really that's the front that you really need to have Jesus Christ, for the center like that all across the US, or an online program for students to take more information. Right now, the best we have is workshops, but it's not really enough. Much like legal, we need actual coursework.
Yeah.
Like legal interpreting, you should have already finished them. Legal interpreting already has some, but with legal, there's nothing.
Exactly.
With medical, there's nothing.
And that's why medical interpreters accepting jobs on their first day or within their first year has created so many problems and has created a distrust in the deaf community of interpreters in medical settings. One highly suggested idea is to enroll in a beginning level nursing program. You get all the exposure to basic level nursing and anatomy, basic procedures, and that will give you a really good ground floor in an emergency room situation.
That's a good idea. One more story that I want to share. And this happened 7 or 8 years ago. One student, a second year interpreting student, who had already graduated from here, who had not yet graduated from here, decided to join a local agency. And I've been preaching to all of them not to accept medical jobs right away. But not everyone listened to me enough, clearly. So that student accepted a medical job for their own deaf teacher. Without the knowledge of their deaf teacher. And they didn't know the name of the client before they had shown up. So they went in, saw their teacher, said, "Oh shit." And they tried to go ahead, but they weren't ready for it, obviously. And that person who doesn't work here anymore, that teacher, actually filed a complaint to the RID against that student. So beware. Warning, warning, warning. That was the first time. The fun time.